Welcome back to the YouTube channel Doctor's Wisdom Share. Today, I am sitting here to talk to you about a topic that I want to name very directly. Snoring. Be careful, because it can cause accidents. I will divide today's content into three parts. Part 1. How dangerous obstructive sleep apnea syndrome, OSAS, really is. Part 2. Classification of snoring, symptoms, and diagnosis of sleep apnea. Part 3. Whether snoring and obstructive sleep apnea can be treated. Now I will begin with part 1. I would like to ask you a question. I believe that many of us participate in traffic every single day. Some people ride motorcycles. Some people drive cars. I want you to imagine this situation. When we are sitting in a car or riding a motorcycle, the road is relatively empty. There are very few vehicles. The sunlight is bright and glaring, and around us if we are in a car there may be cool air conditioning and gentle background music. Under these conditions, we begin to feel very sleepy, and then, at a certain moment just 1 second nod off. Immediately after that, we suddenly jerk awake. The same thing can happen when riding a motorcycle. I want to provide some data so you can better visualize this. In 2023, there were 21,880 traffic accidents nationwide. When the causes of these accidents were analyzed, 0.33% were attributed to fatigue and drowsiness. If we calculate this precisely, it corresponds to about 70 accidents. That is not a small number. And if we look at statistics from other countries, traffic accidents caused by driver fatigue account for more than 25% of all traffic accidents worldwide, which is 1/4. This is 8 times higher than accidents caused by drunk driving, and it accounts for 40% of serious traffic accidents. Loss of concentration and drowsiness while driving. Let me be very honest among the consequences caused by snoring, or in medical terms, obstructive sleep apnea syndrome. So beyond traffic accidents, what other consequences might people who snore face? I will answer this directly, and I want to go into it very carefully. Today's topic is snoring. Be careful, because it can cause accidents. But if you look at the number I just mentioned, at more than 21,000 accidents per year, and only 72 caused by drowsiness, a rate of 0.33%, some people may immediately say, oh, 0.3% is too small. 72 cases out of 21,880 accidents is insignificant. It's not worth making such a large program about. That is an intuitive way of looking at it. And indeed, if we only look at it intuitively, it does seem contradictory. But I want you to look at it from another perspective. I want to see how things are handled around the world. I examined neighboring countries such as China, Japan, and South Korea, as well as European countries and the United States. What I found was that the proportion of traffic accidents caused by fatigue or drowsiness ranges from 25% to 30%. This means that in countries where people have snoring problems or obstructive sleep apnea, the rate of traffic accidents related to these issues is much higher. So I asked the question in reverse: is it possible that our statistics are incomplete or insufficient? From medical doctors to accident investigators and statistical systems, it is very possible that the data is not fully captured. And precisely because the data is incomplete, public awareness remains low. Where does this lack of awareness show itself? It shows in the fact that many people snore, yet they never go to a doctor for examination or treatment. Instead, they listen to advice from acquaintances, follow various self-diagnosis and self-treatment methods, apply them to themselves, and if they do not work, they simply stop. In some cases, the situation even worsens, and this creates serious social consequences. If we take the lowest international figure, 25% of traffic accidents caused by fatigue or drowsiness, and if people truly understood that up to 1/4 of traffic accidents are related to this issue, public awareness would certainly be much higher. And you must understand this clearly: snoring causes many health consequences, not just traffic accidents. Meanwhile, traffic accidents worldwide have become a kind of pandemic. I work in a hospital, and during night shifts, I can honestly say that we fear traffic accidents because they are truly horrific. People arrive already deceased. Those who survive often pay the price with lifelong disability. And that burden is not borne by the patient alone, it is borne by their family members and by society as a whole. Therefore, this program is not only a warning. I want to awaken awareness about how dangerous snoring truly is. You may not yet fully grasp the level of danger, so let me give a very concrete comparison. I will compare snoring to something that everyone fears when driving alcohol. We have very clear regulations. When participating in traffic, drinking alcohol is prohibited. There are many experimental studies worldwide comparing how dangerous it is to drive while snoring or having sleep apnea versus driving after drinking alcohol. For example, in one study, researchers divided participants into two groups. The first group consisted of people who snored. The second group consisted of healthy individuals who did not snore, but they were given alcohol until their blood alcohol concentration reached 0.07%, which is equivalent to 70 milligrams per 100 milliliters of blood. At this level, in many countries around the world today, penalties are extremely severe fines and long-term suspension of driving licenses. Clinically, individuals at this level often show excitement, increased talkativeness, altered perception, and reduced behavioral control. They were not allowed to drive on real roads. Instead, they were placed in driving simulators. The result was that people who snored and people with a blood alcohol level of 0.07% showed equivalent impairment in vehicle control and equivalent risk of causing accidents. In other words, snoring while driving is no less dangerous than driving under heavy alcohol intoxication. And I want to emphasize that many of these studies only examine mild snoring. If snoring is moderate or severe, the risk is even worse. I will add another statistic. In the United States, snoring and sleep apnea are recorded as the third leading cause of traffic accidents. There are also statistics showing that people with moderate sleep apnea have a much higher likelihood of causing traffic accidents compared to healthy individuals. I say all of this so you understand that traffic accidents caused by drowsiness are only one part of the story. Beyond traffic accidents, there are workplace accidents and daily life accidents. Some people fall from construction sites. Some lose entire hands while operating machinery. Some suffer extremely severe injuries. These situations are truly terrifying. However, due to time constraints, I will focus on traffic accidents to wake up public awareness. Let me say this clearly. When issuing driving licenses, health examinations usually include vision tests, color discrimination, and hearing tests. But in the United States, Canada, and several Western European countries, there is another condition that must be evaluated and certified by a physician before a driving license can be issued or renewed: obstructive sleep apnea. If a person has this condition, they must provide medical certification showing effective treatment before being allowed to obtain or renew a license. In some regions, doctors are legally responsible for reporting untreated cases to authorities for possible license revocation. I once told a story about an acquaintance of mine who worked as a driver in California. He snored heavily and had his driving license revoked. He was shocked and did not understand why. It turned out that during a medical examination, the doctor identified sleep apnea and reported it to authorities, who then revoked his license. And this is not limited to California. Many other states have also legalized this requirement. I will share another story from the United States. A dentist volunteered to participate in a snoring study. After the study, researchers discovered that he had mild sleep apnea. Several months later, he received a notice requiring him to report his snoring condition, where he was being examined, and whether he was receiving treatment, and he was warned about the risk of license revocation. He was interviewed and said that he was not upset because he viewed this as a public safety measure. In a country that places great importance on personal data privacy, the fact that snoring is treated so seriously should help you understand its significance. In the European Union, this issue has long been taken seriously. In 2012, a working group was established to revise health requirements for driving licenses. It requires individuals with sleep apnea to demonstrate effective treatment before being allowed to drive. Since December 2015, All member states have been required to implement these regulations. Some countries enforce them very strictly, including mandatory testing and close monitoring during the early stages of treatment. I say all of this to show you that developed countries treat snoring and sleep apnea as a very serious condition in driving license regulations. In the United States alone, tens of millions of people are estimated to have sleep apnea. This is a very large number. Without proper management, the danger is enormous. However, in our driving license system, sleep apnea has not yet been included. This may be one piece of the puzzle explaining why traffic accidents remain high, even though alcohol control has improved. So I emphasize again, the best approach is individual awareness. If you drive and you snore or have sleep apnea, it is dangerous. If you are riding in a vehicle driven by someone who snores heavily or has severe sleep apnea, especially on long-distance trips, you must be cautious. Even within families, if a husband snores heavily and drives long distances, it should be reconsidered. If the wife does not snore, why not learn to drive and take turns? When one is tired, the other drives. Changing habits protects yourself, your family, and the community. That is why in part 1, I emphasize traffic accidents. I want to add one very important point to help you visualize the issue. About 1/3 of our lives is spent sleeping. And it is not just sleep itself that matters. Sleep quality is extremely important. It affects work capacity, work efficiency, learning ability, and everyday life. Many people sleep for many hours and believe they sleep well. One very common mistake that I encounter is the belief that snoring means sleeping soundly. That is not true. Snoring does not only disturb others. More frighteningly, snoring can be one of the causes of death. I am not saying this to scare you. I will give you a concrete example so you can see that it is real. If you follow weightlifting, you may know a famous Chinese weightlifter who won multiple world and Asian championships. He was extremely well known. After achieving success, he retired at the age of 33. But on October 31st, 2020, he was found to have acute respiratory failure. The cause of this acute respiratory failure was severe snoring and severe obstructive sleep apnea. He developed acute respiratory failure, was hospitalized, experienced systemic collapse on the same day, and ultimately passed away. This story shows that sudden death can occur due to snoring and airway obstruction during sleep, often without prior warning. When talking about sudden death, many people say it is rare and not worth worrying about. But global statistics show that approximately 7,000 cases of sudden death each year are related to snoring and sleep apnea. What is sudden death? There are many definitions, but simply put, it refers to death occurring within 24 hours due to a rapidly progressing cause. Severe sleep apnea can lead to sudden death. The number 7,000 may not be the largest compared to other causes. But the most frightening aspect is not sudden death itself, it is the diseases and indirect deaths caused by snoring, which are far more common. Let me return to a point you may have heard mentioned: chest pain, memory decline, daytime drowsiness. Are these related? Because fundamentally, snoring, especially severe snoring, leads to sleep apnea. The airway narrows, which causes snoring. Even when breathing continues, oxygen intake is reduced. When apnea occurs, oxygen deprivation becomes much more severe. When the blood does not receive enough oxygen, the body is pulled into a cascade of systemic consequences. Nighttime hypoxia leads to poor sleep quality. Poor sleep leads to daytime fatigue and drowsiness. Daytime drowsiness leads to falling asleep while driving. Falling asleep while driving leads to accidents. Research shows that even mild fatigue slows reaction time while driving. Moderate drowsiness causes delayed responses and forgotten driving actions. Severe fatigue leads to driving on autopilot with impaired judgment and even micro-sleep episodes. This is extremely dangerous. But traffic accidents are only one part of the story. Let me continue with the disease mechanisms. Oxygen deprivation affects all organs: the endocrine system, the nervous system, and humoral regulation. Hypoxia induces oxidative stress and triggers the release of biochemical mediators. For example, the adrenal glands release cortisol and adrenaline stress hormones. Adrenaline affects blood vessels and heart rhythm. Heart rate may increase or decrease irregularly. Over time, this leads to hypertension. Hypertension leads to atherosclerosis. Atherosclerosis leads to stroke and myocardial infarction. Metabolic disruption can contribute to diabetes. Heart rhythm disorders may occur, including premature beats, atrial fibrillation, and ventricular arrhythmias. All of these can occur in people with obstructive sleep apnea. Among diseases associated with sleep apnea, the first group most frequently mentioned is cardiovascular damage. This includes arrhythmias, myocardial infarction, coronary artery disease, and even heart failure. The next group is vascular disease, including stroke. Then there is a group that many people do not think about: metabolic disorders, especially type 2 diabetes. Many people never imagined that snoring could contribute to diabetes. But when examined carefully, the connection becomes clear. The mechanism linking snoring and diabetes is quite fascinating medically, but it would require an entire separate program to explain fully. Type 2 diabetes is a major focus in medical research, with dedicated studies examining its relationship with sleep apnea. And we all know how dangerous diabetes is. It affects quality of life and threatens life itself. Then let me talk about the liver. Why is snoring related to the liver? At night, bodily regulation is primarily controlled by the autonomic nervous system, including the vagus nerve. Many people have experienced abdominal pain, reflux, or biliary colic triggered purely by emotional stress. When snoring causes oxygen deprivation, it affects both the sympathetic nervous system and the vagus nerve. Stimulation or inhibition of the vagus nerve affects liver function. This leads to various liver conditions, most commonly fatty liver disease, even in people who are not obese. Some people are very thin, have normal blood lipid levels, and appear healthy, yet suddenly develop fatty liver. They do not understand why. I have encountered many such cases. When doctors ask me, why does this person have fatty liver when lipid levels are normal? I ask one question: do they snore? It turns out they have sleep apnea, and the incidence of fatty liver increases many times in this group. Beyond fatty liver, liver dysfunction, hepatitis, and other serious liver diseases are also associated. Then there is the digestive system. Vagal dysfunction at night leads to gastroesophageal reflux. Reflux causes severe pain, coughing, bronchitis, asthma, and one particularly frightening consequence is esophageal cancer, especially in the lower third of the esophagus. In esophageal cancer, the lower third is most commonly affected, and the primary cause is chronic reflux. Yet many people do not realize that the root cause may begin with snoring. When oxygen is insufficient, the body weakens. The sphincter between the stomach and esophagus becomes lax. Combined with vagal stimulation, gastric contents are pushed upward. In summary, many organs are affected. Then there is mental health. Stress hormones, such as adrenaline and cortisol, along with metabolic changes, affect the autonomic nervous system. This leads to anxiety, depression, irritability, and personality changes. There are also psychosexual manifestations. Men may develop sexual dysfunction, including erectile dysfunction. Women may experience reduced libido, hormonal disturbances, and even premature ovarian insufficiency. Honestly, I could list consequences all day. I want to emphasize one thing: at least 25% of the population snores regularly, and based on real-world observation, the number may be even higher. Snoring is a silent source of many diseases that we do not recognize. That is why I want you to care about this topic and explore it deeply through this program, so you know how to prevent and treat it. Now I move to part 2, classification of snoring, symptoms, and diagnosis of sleep apnea. There is a saying, eating well and sleeping deeply equals happiness. But statistics show that about 25% of the population snores regularly. If converted into absolute numbers, this means billions of people snore when they lie down to sleep. And about 45% of people snore occasionally. This means that 7 out of 10 adults have snored at some point. This is an enormous number, but not all snoring represents disease. Why do men snore more than women? Why do older people snore more than younger people? First, we must understand why snoring sounds occur. I often use a physics analogy. When wind passes through a narrow mountain gorge or cave, it creates sound. The narrower the passage, the sharper and louder the sound. Snoring works the same way. Our airway consists of the nasal cavity and the throat. If any part becomes narrowed, airflow passing through produces snoring sounds. The loudness and pitch depend on the degree of narrowing. Why do older people snore more? Because the muscles of the soft palate and pharynx, which normally hold tissues up and keep the airway open, weaken with age. They become lax and sag, narrowing the airway. In addition, older adults, especially men, are more likely to have calcium and magnesium deficiency. These deficiencies weaken muscle tone, making snoring more likely. Why do men snore more than women? If you open your mouth and look in the mirror, you will see the uvula hanging down. If the surrounding space is narrow, snoring is more likely. Men tend to have thicker necks, shorter and broader airways, and more soft tissue and fat in the pharyngeal region. The posterior tongue in men is usually larger and thicker, further narrowing the airway. The nasal cavity can have many conditions: deviated septum, narrow nasal passages, polyps, turbinate hypertrophy, or nasopharyngeal disease. Nasal snoring can often be resolved by treating nasal pathology and is usually not too serious if addressed properly. The third group is true snoring, which is obstructive sleep apnea syndrome. Once apnea occurs during sleep, this becomes a severe medical condition. In summary, Groups 1 and 2 are risk groups that can progress into Group 3 if not managed. Only by understanding this deeply can we diagnose and treat appropriately. I will be honest and share something personal. I myself occasionally experience fatigue-related snoring after social drinking, excessive work, night shifts, or high patient pressure. But because I understand my body and disease mechanisms, I adjust quickly and do not allow myself to progress into the severe group. I want to share another hospital story. Some people snore so severely that they fall asleep within minutes of sitting down. Some even fall asleep while standing. Their memory declines, reflexes slow. Some cases are mistakenly evaluated for cognitive disorders, when the true cause is chronic sleep deprivation and hypoxia. Now, let me return to the question: what are the symptoms, and how do we diagnose sleep apnea? Everyone knows snoring as a sound, but sleep apnea requires counting the number of breathing pauses during sleep. If you have a family member with this condition, you may observe the following: loud snoring, like a tractor or bellows, gradually increasing in intensity, then suddenly stopping, no breathing for several seconds or even tens of seconds. Then the person suddenly gasps awake, breathes again, and falls back asleep. This cycle repeats. The moment of silence is the apnea episode. For simple assessment, family members can observe and count. If apnea episodes are fewer than 5 per hour, it is usually not too concerning. 5-15 episodes per hour indicates mild sleep apnea. 15-30 episodes per hour indicates moderate sleep apnea. More than 30 episodes per hour indicates severe sleep apnea. Remember the numbers: 5, 15, 30. Doctors also assess daytime sleepiness, because poor sleep and nocturnal hypoxia cause excessive daytime sleepiness. They measure oxygen saturation at night and during the day, before and after using continuous positive airway pressure (CPAP) therapy. Doctors also examine the throat, nose, and whole body. Obesity, diabetes, metabolic disorders, calcium and magnesium deficiency, all of these contribute to pharyngeal muscle laxity. The resulting symptoms are numerous: dry mouth, dry throat, bad breath, morning sore throat, fatigue, daytime sleepiness, hypertension, arrhythmias, diabetes, reflux, digestive problems. Virtually every system can be affected. Honestly, listing everything could take all day. But I want you to understand one thing: this disease pulls other diseases along with it, forming a chain. We must break the chain link by link. Some people are fortunate to have strong constitutions and follow natural rhythms, developing fewer illnesses. Others, like myself in childhood, were physically weak and frequently ill. By understanding health knowledge, I restored balance and now work intensely without frequent illness or medication. I say this to emphasize, knowledge allows us to save ourselves. Now I move to part 3. Can snoring and sleep apnea be treated? Snoring has existed for a very long time. For generations, people have used various methods, folk remedies, elevated pillows, side sleeping, anti-snoring devices, surgery. Some methods work for certain people and not for others. Some work today and fail tomorrow. I will share a story. At one point, American media noticed visible marks on the face of a U.S. president. It was later explained that he had recently begun using a CPAP machine to treat sleep apnea. This shows that snoring spares no one. A common question is about surgery. Surgery was once considered a definitive solution and is heavily advertised. But does it really work? I answer based on real patient encounters. Some people tell me they plan to travel abroad for cold plasma surgery, advertised as a 30-minute painless procedure with permanent cure. I speak honestly, snoring surgery is not new, and many countries have done it for years. But I advise caution. All snoring treatments, including surgery, only work for certain groups. They do not work for everyone, and even for one person, effectiveness may diminish over time. I share another case. In New York, a train operator fell asleep and caused an accident injuring many people. He had sleep apnea and was under treatment, but the treatment was not consistently effective. When symptoms recurred, the accident happened. This shows that even CPAP, when effective today, may not remain effective without proper control. What does snoring surgery do? Simply put, when the uvula hangs down and soft tissue accumulates on both sides, surgeons remove part of the tissue, sometimes part or all of the uvula, to widen the airway. The procedure itself is not technically difficult, but the problem is recurrence. Studies show recurrence rates can exceed 90%. I have seen many patients who sleep quietly after surgery for a while, then gradually return to snoring, sometimes worse than before. Scar tissue may thicken, or lifestyle factors are not controlled. So does surgery work? My answer is yes, it can work, but not for everyone, not permanently, and not universally. Some people are thin, and the soft palate is not the main problem. Their issues may be calcium deficiency, magnesium deficiency, muscle laxity from alcohol use or stress. Surgery in such cases addresses the wrong target. I do not agree with exaggerated advertising claiming one procedure, permanent cure. However, there are cases with structural problems that do require intervention. In dentistry and maxillofacial medicine, malocclusion and orthodontic treatment can significantly improve snoring and sleep apnea. In nasal polyps, deviated septum, narrow nasal passages, turbinate hypertrophy, and sinus disease can be treated. Some cases involve tumors at the base of the tongue or enlarged tongue base requiring intervention. In children, enlarged adenoids cause snoring, mouth breathing, dental crowding, and facial changes known as adenoid phases. Early adenoid removal leads to rapid improvement. Enlarged tonsils that cross the midline also cause snoring and may require surgery. In summary, medical evaluation to identify structural causes is essential. So how do we prevent snoring and sleep apnea? First, identify the cause. If alcohol triggers snoring, reduce alcohol. If stimulants are used in the evening, reduce or stop. Avoid sedative abuse. Do not let your body become excessively fatigued or stressed. Exercise and maintain physical and mental balance. Regarding sleep posture, side sleeping or prone sleeping helps. Hugging a pillow or a partner is anything that creates a three-quarter side position. Supine sleeping allows soft tissue to collapse and narrow the airway. Side or prone positions reduce collapse. Elevating the pillow helps, but do not elevate only the head. Elevate from the shoulders upward. Elevating only the head bends the neck and narrows the airway. These measures help prevent progression from mild snoring to sleep apnea. Now I come to what I consider the most important part: training. I believe training is the most important method. Surgery or CPAP may help temporarily, but many people do not maintain long-term effectiveness. Training, based on my personal observation and guidance of many individuals, improves symptoms significantly and in some cases resolves snoring completely. Training consists of two groups. The first group is proper breathing training. The secret to health is breathing. Proper breathing is essentially Qigong, but Qigong is simply breathing, not mysticism. In daily clinical practice, especially when guiding deep breathing, I observed that about 70% of women breathe incorrectly. I recall a famous physician who suffered from severe pulmonary tuberculosis and lost most of his lung capacity. He was predicted not to live long. Yet through breathing exercises, he lived healthily into his 80s, remained active, and contributed greatly. This illustrates the power of breathing. Two muscle groups are involved in breathing. The intercostal muscles lift the rib cage, but contribute little to lung volume. The diaphragm muscle separating the chest and abdomen is the key. When inhaling and the abdomen expands, the diaphragm moves downward and lung volume increases significantly. When exhaling and the abdomen contracts, the diaphragm rises and lung volume decreases. Therefore, proper breathing is inhale abdomen expands, exhale abdomen contracts. Most men naturally breathe this way. Many women breathe using the chest, which is less effective. To make this a natural reflex, practice is required over time. I did not know this initially either. I corrected myself whenever I remembered, and eventually it became automatic. Breathing has 3 phases: inhale, pause, exhale. Healthy individuals can balance all 3 phases. Those less fit should start gradually. Breathe through the nose with the mouth closed. You can practice lying down or sitting. Practice as often as possible, increasing duration and frequency gradually according to your capacity. Proper breathing strengthens the diaphragm and intercostal muscles, improves airflow, reduces airway turbulence, and engages neck and soft palate muscles more effectively. The second group is training the muscles of the mouth and soft palate. Weak pharyngeal muscles become lax and narrow the airway. Strengthening them improves airflow. Exercises include protruding the tongue fully and retracting it fully, about 200 repetitions. Pulling the tongue deep into the mouth and forcefully pressing it upward against the palate, 200 repetitions. Chewing gum with the tongue, moving it around the upper teeth, lower teeth, cheeks, and palate, mimicking chewing. Dry gargling, puffing the cheeks and contracting them as if gargling without water, 200 repetitions. Each exercise can be done about 200 times. Practice 3-5 times per day initially. Once improvement occurs, frequency can be reduced to once per day or even a few times per week for maintenance. I hope that through this program, you gain knowledge to understand the seriousness of snoring, learn how to prevent it, and choose appropriate treatment methods. I sincerely hope that no one develops severe snoring, and especially that no one experiences traffic accidents or the many diseases I have discussed. Thank you for following such a long program with dense information. Thank you for your support, which gives us the motivation to continue. I will end with one final thought. Many illnesses in life do not require medication immediately. Many diseases arise from lifestyle, diet, living conditions, work habits, and environment. If we understand and correct these factors, we can avoid disease. Persistence matters. If you consistently train, change habits, and seek knowledge, your health will improve. If not, frequent hospital visits and reduced lifespan become difficult to avoid. Snoring is a problem that I believe can be significantly improved, but it requires multiple approaches, not just one. Most importantly, knowledge. I know today's information is dense, and this is a topic many people have long underestimated, thinking snoring is just snoring. But based on everything I have explained, I hope you now see snoring differently, not just as noise, but as a warning sign of a chain of health problems and even social consequences such as traffic and workplace accidents. I hope you remember a few key points. First, snoring has different categories. Not everyone who snores has severe disease, but some forms can gradually progress if ignored. Second, in sleep apnea, family members can observe the pattern of loud snoring, silence, and sudden gasping. Remember the thresholds: under 5, 15, 30, over 30 apnea episodes per hour. Third, regarding treatment, improvement is absolutely possible, but there is no single universal or permanent solution. Some people need structural treatment, some need orthodontics, some need CPAP, and everyone needs lifestyle modification. The foundation remains breathing training, oral and pharyngeal muscle training, and healthy sleep habits. I also want to caution you against exaggerated advertising. Surgery or advanced techniques may help some people, but recurrence is possible if underlying factors are not controlled. Thank you for patiently staying until the end. I know long content is not easy, but disease is never simple enough to explain in one sentence. That is why I intentionally explained in a circular, branching manner examples, detours, and returns to help you connect the dots. How nighttime hypoxia leads to hypertension, arrhythmias, diabetes, reflux, fatty liver, psychological chains, and ultimately circles back to what seems like a small issue, snoring. If you have watched until now, I ask you to do one practical thing. Do not just listen and forget. Tonight or in the coming days, apply the simplest measure: adjust your sleeping position, avoid alcohol at night, reduce stimulants, sleep on time, and begin proper breathing exercises with abdominal expansion. If you have a family member who snores heavily, has clear apnea episodes, or excessive daytime sleepiness, do not rely on folk remedies indefinitely. Seek medical evaluation to identify the cause. Thank you, and goodbye. I look forward to seeing you in future programs, where I will continue to explore breathing exercises and throat muscle training in greater depth, cause, when done correctly and consistently, I have seen truly meaningful results in real life.